let me tell you some of what I feel. There are a lot of people doing a whole lot of good work. A lot of research going on by independent journalists throughout our country. There are a lot of students writing and doing a lot of research papers, etc. But if you read the New York Times or the Washington Post or any one of the major newspapers, the Houston Chronicle, there are select numbers of articles that you're going to read, that you're going to have to. All those articles go through the producer network within that particular company, New York Times or whatever. And each of those companies have two things that are important. Their first of all, their bottom line, and then their ideology. If you take a look at a paper like the Houston Chronicle, you won't see very liberal stories or stories that would have a liberal bent. If you take a look at the New York Times, I know a lot of conservatives like to consider the New York Times the progressive paper of record. It's far from that. At best, most of us progressives consider the New York Times a center-right paper. In other words, it's always towing the line. And to put it bluntly, it tows a very neoliberal style mindset. So therefore, there are a lot of other rags around. I mean, we have the Nations magazine, Mother Jones, we have Daily Kos, you have the independent blogs that I write. You have a lot of people doing a lot of research and good work out there. Why is that important? Because stories that many haven't heard of, many don't understand, many don't see, these get covered. One of the things that I do at this program is many times amplify other stories from rags most people never heard of, don't read, but that are reputable with the information that they have and has a whole lot of backing in said information. And this particular article tickled my fancy yesterday from Mother Jones, and it had a well-researched article. It's a very long article, and the person who wrote the article, it's clear they put a lot of effort into getting their data and getting all this information. Why do I preface it that way? Because one of the reasons we want folks to see these things is that in our healthcare system, whenever we try to make major changes, it is hard. And why is that hard? Because at any given time, most people are relatively healthy. So they are not in contact with the healthcare system on an hourly basis, on a daily basis, etc. So you go through the pain of being with the system for a few hours, if you're lucky, a month or a year. But otherwise, it's just a thing. So you don't get a chance to see those people who have to be chronic users of the healthcare system because of their condition. But the one thing that we know is that at some time, most people at some part of their lives will have some sign of chronic use of the system. And when you get there and it's not there in the right form, it can be devastating. I have a wife with lupus, a wife who just got shingles, a daughter that's had 2 strokes. I stay away from the hospital system, maybe stupidly, but I do, because from the healthcare system, because I have some prejudices against how the system treats people like me. Now, that said, this article about dialysis really was difficult to read. And why is that? Because we have a system that, for the most vulnerable people, it can be very unfair and it can be very inhumane. And the story that Jack started about was Tommy's story. And Tommy was somebody that went in, goes to dialysis treatments 3 times a week. But the one thing he is somebody who wanted to make sure that the people who are giving him this dialysis were doing a good job. And because he complained, he was referred to or called belligerent. And under the law, they were able to deny him care. So ultimately, what happened to Tommy in this system is that Tommy had to wait till he's near death each time from not having dialysis for days, go to the emergency room to get cleaned out, and the cycle begins again. But none of the dialysis companies, and there are two major dialysis companies, DaVita and a German company of which I can't recall the name right now. They own 80% of the market. It's been corporatized, the entire dialysis system. Backstory. In the past, when dialysis just came out, there were few dialysis machines in the 60s, but there was a committee called the God Committee. And the God Committee selected the people around the United States who would be lucky enough to use the limited resources of dialysis machines. As time went on, supply caught up with demand, but it was still an expensive proposition, about $150,000 a year to be on dialysis. And by the way, all of this occurs because of patents and the commercialization of machines, all of that. I mean, the dialysis doesn't really cost $150,000 a year for a patient. But that's what is charged. That's what a capitalist system does to healthcare. But we'll tackle that a little bit further down. So the God Committee selected who got dialysis back in the 60s when it was invented. And after the 60s, when it was invented, we got the United States government in 1972 said, well, you know what? We are going to make kidneys a special case, and Medicare covers kidney dialysis. And then all these private companies sprung up to give dialysis machines. You know, your nephrologist had a dialysis machine, little companies had dialysis machines, and they were all able to, make a little profit on giving dialysis. The government was paying for it. Socialized medicine with the assistance of the private sector delivering the care, which meant somebody who owns that dialysis company or that little doctor's shop made a few dollars. Not extraordinarily so. Look, I wouldn't have had that layer at all, but hey, we had that and that worked for a while. But then the government opened it up that said private investment companies and all of that could buy up and be a part of the game. And when they became a part of the game, they started buying up all these little dialysis shop around the country, your private doctor's dialysis center, your small company dialysis center, and they bought it all up, and now they own 80% of the market, two companies. What that means, of course, is that we have a great welfare system for these companies. They provide a service at officially no risk. If you have a sure payer in the government, right? What does that mean? That means you don't have any risk. But the idea behind big profits, if you follow the capitalist model, is that the reason you allow companies to have big profits is because it purportedly creates innovation with those profits. But again, if you don't have the risk, there are two things that happen when you don't have this risk. There's no real need for further innovation. Things are currently working fine. So what do you do next? The next thing you do is you say, all right, since we believe in it, since this system says we want exponential growth. What exponential growth looks like is the people who invest in these dialysis companies now, they may expect a 7% return every year. In other words, they want 7% growth, not return, growth. They want 7% growth every year. That's exponential growth. It's something that is not sustainable. So how do they do it? When you had these big companies buy up all these dialysis centers, now two companies own it. Again, the default state of capitalism is monopoly. They would try to tell you no. Government intervention stops monopoly when it prevents monopoly. So the default state of capitalism is to create monopolies. But how do you stop the monopolies? You create government intervention that mitigates capitalism to stop that behavior. That's not what has happened in dialysis These companies control 80% of the market. And in doing so, the next growth state that they have is, how, now that we own the entire damn market, how can we even make more money? And the way they do it is they say, okay, we used to have professional nurses like they have in Canada or Australia or these other countries. We used to have professional nurses that did the work. Well, professional nurses cost too much damn money. So now they have specialized technicians that's trained to do just that job. And for the most part, that works, right? Of course, until some patient has behaviors, etc., that only a professional healthcare provider can understand, away from what they have to do in dialysis. So that's what they do to reduce their costs and to have more people, and to have more profits for the investors in these new companies that now control your dialysis. And when that doesn't work, they start using cheaper material. So what a lot of patients were noticing is they were using cheaper bandages that cause rashes on people, that hurt people, etc. And according to the law, a dialysis center can bar somebody from taking dialysis if they become a problem patient. The CMS, Center for Health, I don't remember what it stands for, allows them to go ahead and deny service to these people. And they ask them, if you're going to deny service to this patient, try to find them another place. But if you can't find them another place, no big deal. The patient just have to see what the patient can do. Wait till they get sick enough to go to the dialysis, to the emergency room, which is what happened to Mr. Tommy. So these patients are starting to complain that their bandages don't work right. The nurses don't know what they're doing. They're not really nurses anymore. So the service declines, and they start to push people through like cattle. If you go to a Davida Center, according to the article, and I see them all around Houston, and I imagine you see them all over the country. You go to one of these places, you're like a cattle, just giving people through. They have to get you into the machine, sanitize the machine, go back into circulation and do it. And a lot of it wasn't doing right. And if you go ahead and complain about your bandage, if you complain about your service, they start to put inside of your record that you are a problem client, a problem patient. And that record follows you. And so what they're doing is they're building the case that this person is going to complain about our service. Let's build a case so that when we cut the plug, we can have a case that says this person has been a problem client for a long time, a problem patient for a long time. That is what our system devolves to, a healthcare system that is based on profit and not humanity. I'm going to talk about the profit in a little bit. So what we find is, in a country right now, over 5,000 people at this time, right now, have been told that they cannot use these services anymore. And these are people that ultimately wait till they get very sick, go to an emergency room, their blood gets taken. Oh my God, you're in renal failure. We got to give you dialysis right now. And then you wait till you get sick again, and you get dialysis again and again in the emergency room at a higher cost that we all pay. All of this because these companies that control the system want exponential growth. Not only exponential growth, but they want the ability to go ahead, do as they please to make for their shareholder.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead, number one, subscribe to our channel, and number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.